don't have anyone at my apartment right now, but I wanted to get this done, so I'm just gonna pretend and go through everything that I would do on a patient. So starting off, I would come into the room, I would knock on the door, perform my hand hygiene with either an alcohol-based hand sanitizer, or I would wash my hands. I would introduce myself, say that my name's Carson, I'm a student nurse. Is it okay if I do a quick head-to-toe assessment on you? If I get their consent, I would start my assessment. I would take their vitals. I would get their temperature, their heart rate, their pulse, and note how, if it's thready or if it's strong, if it's a regular rhythm. I would note their blood pressure. So I'd take their blood pressure, make sure that that's normal. I would want to take pulse ox, and I would want to know their respiratory rate. And I would take their respiratory rate while I was taking their pulse. I would then do a quick neuro assessment, asking them if they know who they are, where they are, if they know what year they were born, basically making sure that they're alert and oriented to time and place at least, and then seeing if they can answer some questions about the past and the present, so that I know if they understand their memory has been affected. I would also want to assess their level of consciousness, if they're able to communicate with me, if they're able to answer my questions, if they're able to follow commands. If I ask them to raise one arm and leave the other arm down, can they do that without me prompting them? Can they do that with little to no help? That kind of stuff. I would also want to look at their pupils, make sure that they're round and both reactive to light at the same time in the same way. I would check and see if they have a tremor, that kind of stuff. I would want to note if they have any facial drooping, if there's anything abnormal about their face. I would want to look at their skin, check and see if they have any abrasions, check and see if they have any bruises. I would want to know if they have any bed sores, anything like that, so that we can look and make sure that they're being treated properly and that they don't get worse. I'd want to note if their skin is dry, if it's cool, if it's warm, if it's maybe a little bit clammy. I would want to note the turgor by pinching their collarbone, the skin, and seeing if it tense. If it tense, I would be concerned about dehydration. I would also want to know about their respiratory and cardiovascular state. So I would want to listen to their heart, listen to hear if there's an abnormal rhythm, if I hear any murmurs. I would want to listen to their lungs. I would listen here, 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 under the arm here, and then on their back, just to make sure that I hit all of the lobes, because there can be different sounds in different lobes. I would want to note if they have any respiratory work, if it seems hard for them to breathe in or out, if their breath sounds are equal, if their inspiration is a lot longer than their expiration, or vice versa. I would want to note that. I would also want to note their range of motion and their musculoskeletal state. So on their hands, I would ask them if they can move all of their fingers, if they can touch all of their fingers to their thumb. I'd want to note their strength by asking them to squeeze my fingers or maybe push against my hand. And then on their feet, I would want to do the same thing. And while I'm assessing the feet, I'd probably also take pedal pulses. I would want to know if they can, again, move their ankle and kind of rotate their ankle. I'd want to know if they can, again, push against my hand with their foot and assess their strength and their range of motion and their lower extremities as well. I would want to know their gastrointestinal and gastrourinary state. I would want to know if they're continent or incontinent. I'd want to know their last bowel movement, how their last bowel movement looked. Was it, normal, brown, solid? Was it tarry? Did it have a foul smell, different from like the normal smell? I would want to know the last time that they peed, if there was any sediment in their pee, if it was a normal yellowish color, if there was any blood in the urine, anything like that. I would also assess their pain. I would want to know if they were in any pain that day. If they are, a scale of 1 to 10, how severe is it? Where is the pain? What kind of pain is it? Is it sharp? Is it dull? Burning? Anything like that. And how long the pain has been going on. And then I would want to check and see if they have any IV sites. If they have any IV sites, I would want to assess the IV sites, make sure that they look normal, make sure that the tubing is patent, make sure that nothing looks infected, and that everything is hanging properly for the IV tubing. I would then thank the patient for allowing me to do an assessment, complete my hand hygiene again, and then make sure that I leave the patient with their call bell. And if the patient wants the door closed, close the door, make sure that the bed is lowered if I raised it, anything like that.